Konnichiwa, Dr. Braces here. Thank you so much for tuning in. Today, we have a pretty fun topic. It's going to be, how do you know if your orthodontist did a good job or not? And that's a great question to ask once you're finishing up your treatment. Am I actually done? Now, one way to know if your orthodontist did a good job is when you smile and you look in the mirror, are you happy with what you see? If you're happy with the results and how the smile looks, then you're on the right track. Okay, now there's other things that orthodontists take into consideration much more than the smile. The orthodontist also wants to make sure we get that function right. Okay, so make sure we get you the perfect bite so that function is gonna last you and hold up for the rest of your life. What does that look like? The main thing that we look at is the position of the canine. So let me show you on the model here what that looks like. Okay, so the ideal position of the canine is the upper canine, that's the fang tooth, the one that looks sharp, sits right behind the lower canine and the first premolar. So this is called an embrasure. That's where those two teeth meet together. There's a little triangle right there. You want the canine to fit right in that triangle. That is called class 1. So every orthodontic case, we are trying to achieve class 1 canine on both sides. If both canines are class 1, then almost always the two midlines, in other words, the middle of the top and the middle of the bottom, are going to line up perfectly with each other, okay? The other thing that we're trying to achieve is what's called a 2 millimeter overbite. That just means the top teeth overlap the bottom teeth by 2 millimeters. And a 2 millimeter overjet, meaning the top teeth are in front of the bottom teeth by about 2 millimeters. So when it comes to occlusion, those are the main things you want to focus on. Class 1 canine on both sides, midlines that line up, 2 millimeter overbite, 2 millimeter overjet. I apologize, it's with brackets on. All my models have braces because I'm an orthodontist.
You don't say.
Now, majority of cases, the orthodontist is going to be able to get the teeth straight. The question is, are we going to be able to achieve that perfect class 1 canine bite with the 2 millimeter overbite, 2 millimeter overjet? A lot of that relies on patient compliance, right? So if your bite's off, almost always the orthodontist is going to have you wear some form of elastic or rubber band. If you're compliant with that rubber band, in most cases, you are going to be able to achieve that good bite. If you're not helping the orthodontist out, there's no really other ways to fix the bite without your compliance. And so sometimes a case may not finish with that perfect bite, but usually it's not going to be on the orthodontist. It's going to be a lack of patient compliance in that area. So sometimes it's the orthodontist, yes, did a good job, but the patient didn't really cooperate with everything that they asked them to do, so the bite didn't finish quite perfectly. Now, once a case is finished, maybe things that they're not happy with in the end result. One big thing is something called a black triangle. What that means is if the teeth are overly crowded or overlapping, basically the gums don't really develop the right way. And so when we go and we straighten those teeth out, the teeth are touching the way they're supposed to, but where the gums should be, there's a space. That's what's called a black triangle. There's ways to fix that. You can do a procedure called IPR. That's where you kind of just reshape the teeth a little bit, and then so you reshape the teeth and then you close that space in that direction. Sometimes you can close those black triangles, sometimes you can just make them smaller. But it's not really a result of the orthodontist being negligent. It's more so just biology, and the gums have receded, and without a gum graft, you're not really gonna be able to get that perfect without having some sort of help, right? So definitely better to point those kind of things out before your orthodontist ends treatment, because like I said, you can sometimes make those smaller with a procedure called IPR, but once the braces or Invisalign has stopped, pretty much you have to just accept that that's the way it is. Another one, spacing, right? Especially between the back molars. If you feel like there's food traps there, those are things that can be closed pretty easily with orthodontics, but you have to make sure you let the orthodontist know, because sometimes visually it looks like those gaps are closed, and when you go in with floss, it's kind of light contact, and so you as the patient would know that more than the orthodontist. So if you ever feel like you're having food traps, you have light gaps between your teeth, definitely let the orthodontist know prior to finishing your treatment, because that's something that can be fixed pretty easily, but again, it's just something you as the patient usually has to point out. Midline discrepancies. So what that means is the middle of the bottom doesn't really line with the middle of the top, and so if we go back to the model here, the midlines are slightly off. Looking at it where, in this case, the midline is just a little bit to the right. Those midline discrepancies are things that can be fixed, but you have to wear an elastic, usually on one side, to help swing that midline around. And so if you want those things corrected, again, it's kind of more reliant on patient compliance than the actual orthodontist's ability to do that. Even bite forces. So sometimes you'll just feel like you're hitting heavier on one side than the other. I check every patient's bite before I finish. It usually looks good to me, but sometimes the patient's going to know that more than the orthodontist is, because even if you're marking on paper the right way, you can tell more than the orthodontist if you're hitting heavy. And it doesn't take a lot. I'm talking micromillimeters. Heavier bite on one side than on the other side is going to make a big difference. So you just want to make sure that you let your orthodontist know all of these things before they actually take the braces off. And again, communication towards the end of your treatment with the orthodontist is very important. Ways we can address these concerns after we take braces off. Minor rotations, minor tooth movements you can sometimes achieve with what's called a Holly retainer. That's the retainer that has the wire that goes across the front. You can add springs to those sometimes. So you can make some minor tooth movements after braces come off. But for the most part, it's much, much easier to fix these things prior to braces coming off. So it's important, again, to discuss these things with your orthodontist before they take the braces off. We can do some things called enamelplasty. I do this a lot, like in younger patients where they still have what's called a mamelon. When our teeth are up, especially the front teeth, there's 3 bumps on them. Those are called mamelons. Sometimes patients, those haven't fully worn away yet when I take the braces off. So I'll just kind of help Mother Nature out. I'll smooth those bumps out so the teeth look nice and good and uniform. So that's some ways we can fix some things that we need to. And then the other one is going back into treatment. So a limited Invisalign, limited braces. We can do things like that, maybe like 6 months in braces or Invisalign to touch up on those things that you're not totally happy with. But again, it's much better to do it before you take the braces off than after. So communication there is super critical and important. So thank you so much for tuning in. I hope this video was educational and helpful. If you have any questions or comments, feel free to leave them in the comment section. And if you're interested on how to choose the right orthodontist for you, click here. Remember, smiles change lives, so keep smiling.